This is our COVID Roundup and CDC update for May 17th, 2024. Since last week, we're down about 14% in deaths due to COVID. Putting this into context, we've had 2 weeks where deaths have held constant and 1 week where there have been decreases. Next, when we look to Raj's COVID variant breakdown, we see that JN1 has had a rapid decline. Last week, it was sitting at about 12% in proportion to the other variants, and this week it's sitting at about 7%. And KP3, which I think is the next one to watch, has increased from about 2.5% to about 4%. Moving on to our New York State wastewater map, I think that New York State is now doing updates every 2 weeks. That seems to be what is happening. As a reminder, anything that is dark blue is low levels of COVID in the wastewater, anything that is light blue is moderate levels, and anything from yellow to bright red is high levels of COVID in the wastewater. Since the last reporting period 2 weeks ago, the wastewater levels have precipitously jumped. The proportion of reporting wastewater facilities that are sitting at the high levels increased from around 30% to about 52%. So currently 52% of all reporting wastewater facilities are reporting at high levels in New York. Next, before diving into the wastewater scan data, I want to talk about BioBot Analytics and Verily. BioBot Analytics just released a report that they're going to be sunsetting their public data visualization platform, where they state that with the abundance of publicly available wastewater data and our shift to contextualize for respiratory risk reports, we are sunsetting our public data visualization platform, which is a bunch of BS for several reasons. The first being that their data has not been good or accurate for about 6 months. This is because of them losing the wastewater contract to Verily. If you're not familiar, BioBot Analytics had the contract for doing our wastewater data for COVID surveillance throughout the country. But then about 8 months ago, when they were up for contract renewal, they got outbid by Alphabet's Verily, so Google's subsidiary, which means that Verily underbid them. They offered to do the same services for less money, which is crazy because Verily doesn't actually do any of the wastewater data collection or anything like that. They actually subcontract to Wastewater Scan. BioBot tried to fight that contract change, and they did so unsuccessfully. But because of that contract change, their data stopped being accurate about 6 months ago, or even earlier than that, which is why everyone should be shifting to wastewater scan data, as that is the only wastewater surveillance that is countrywide and is accurate. And this is because a lot of places stopped reporting to BioBot Analytics. They were only doing voluntary data collection from the wastewater facilities over that time period. So that first part of the statement is not true. There is not an abundance of publicly available wastewater data. Only a few states run their entire wastewater surveillance program themselves, New York being one of them. The rest contracted out their wastewater surveillance to BioBot. And now only some of the wastewater facilities have transferred over to Wastewater Scan. This is because Wastewater Scan has certain eligibility criteria, such as having the facility be a minimum requirement of 10,000 people that it serves, meaning that more rural communities cannot be a part of the program. In addition, Wastewater Scan is a Stanford-led program where the majority of the facilities that are being monitored, there's only 194 facilities being monitored throughout the country now, and the majority is on the West Coast, which is why I focus on California, because 58 facilities report to Wastewater Scan in California, and that's the highest level of any of the states throughout the country. So in one vein, it's about damn time, because BioBot clinging on really just screwed things up even more. But there truly is only one program now, and it's Wastewater Scan. Let me show you what Verily does. Verily just recently updated their national and regional trends map, where it's abundantly clear that each successive year, the wastewater trends are increasing, where just like we saw in the New York data, we're having a significant increase in the Northeast, so things are heading back up again already. And they have a map showing all the facilities that are reporting to Wastewater Scan throughout the country, which again does not include several states. You can see that many states don't have any wastewater facilities reporting, and some only have one, with again that concentration being in California, where they have the statement down here saying that all the data should be viewed on Wastewater Scan in detail. So again, Verily doesn't actually do what BioBot did. Wastewater Scan is not the primary and the only really network that we have for monitoring COVID in the wastewater. That's it. So it's very important to note that BioBot should have never lost the contract. Verily was not set up to do what they claimed, or the reason they were able to underbid is that they were just going to subcontract the work to Wastewater Scan. But this is the situation that we're in now. So when we look to Wastewater Scan in California, we see a increase in the data, where the data has a very clear signal now where we are going up. So I believe we have started our summer wave early. And we're also seeing a similar trend in Wastewater Scan when we look to all the 194 facilities that report to them, where again we have a clear signal where we are heading right back up again.